Okay.
So hopefully, welcome everybody to Clear Vision Wednesday. This is my weekly live show all about natural vision improvement, eyesight vision, all the things that we can do to empower ourselves to see better naturally or sometimes with the help of Western medicine. And make sure you subscribe, you click the bell icon because we go live every week and this really helps me to sustain this channel. So today I have a special guest. She's been on here a couple of times. So first of all, welcome back, Dr. Rani Banik.
Thank you so much, Claudia, for having me. I love being here and chatting with your audience. Yeah, we get some great discussions going, so I'm looking forward to today.
Me too. And you are a neuro-ophthalmologist in New York, and sometimes, when holistic teachers like myself, talk to, the traditional eye care doctors, there's more like we don't believe in each other's work, but we have forged a really solid friendship. And I think pretty much on most things we agree. And you have a lot of experience with things that I don't know anything about because I'm not an eye doctor, right? I don't look into people's eyes. But you do that day in and day out. And with your background in functional medicine, you understand that a lot of things that we have an impact on how well we see as we get older, right? Like it's not just age and genetics,
So
right?
true. Yes. And I really am a strong believer. I know you were mentioning, Claudia, about the divide. I really am a strong believer that we need to bridge that divide and to be more open to each other's approaches. And it's just going to benefit our patients, like all, patients, clients all around. I don't think it's healthy to be in silos. I think we really do need to work together.
I could not agree more because both of it, right? A lot of times I send my clients to an eye doctor and say, see an ophthalmologist, please. So today's topic is a hot one because we're talking about the age-related. And I sometimes say it's so easy to just write things off as age-related. Yet I know a 101-year-old friend of mine who passed away a few years ago who didn't need any reading glasses and could see well. Like he would read street signs on his iPhone. And yeah, is presbyopia a common thing, the old age side, cataracts, dry eyes, floaters. So we're going to talk about all these things. And guys on YouTube watching live, ask questions along the way, and I will ask Dr. Rani. So can you briefly describe from your experience in your private practice, like what are the things that you see most often that we would just write off as age related? And yet they're common. We're not saying we don't get older, right? We get wrinkles, things change. We are not going to deny that, right? But what are the common things that you see as people hit their 40s, 50s, 60s?
Yeah, well, the number one thing is presbyopia, which you mentioned. And then I would say the next thing is dry eye. Almost everybody gets dry eye at some point, both men and women, though it's more common in women, especially during perimenopause, menopause. And then finally, cataracts. So those are the top, I would say the top three things that happen to most of us. And if you live long enough, you're going to be lucky enough to have these three things during your life. That's what I tell patients is look at it on the flip side. It is part of aging, like you mentioned. We get wrinkles, we get crow's feet, we get sometimes, bags and sags around our eyes. That happens with age, but some of these eye issues are also age related, unfortunately. But there's
Yeah.
lots of ways to manage them. There's so many ways to manage them.
Well, that's good. Dry eye is a good one. So I've never had dry eyes. I never took bioidentical hormones. I've been in menopause for 14 years. And maybe that's one where I feel like things that I'm teaching, like blinking and resting your eyes and a lot of these things, closing your eyes more, and obviously like, are the eyelids all the way closing? But and sometimes it must be hormones too. And obviously some people have Sjogren's or other autoimmune conditions where it's not as easy, but that's definitely one. Like, let's start with that one. And like, what are things that you feel? Because I know you told me even about the FDA recall of some of those eye drops. Like, a lot of people are relying on these artificial tears, what they're called, right? So, what is your approach when you find somebody and they have dry eyes? Because dry eyes is obviously dangerous, right? Corneal scratches. We don't want dry eyes. That's not good.
Yeah, yeah. So, I always like to think about things from a root cause analysis. I guess that's where my functional medicine training comes out. But when you think about dry eye, there are really like two big categories of dry eye. One, which is the bigger category, which 80% of people fall into this category, have evaporative dry eye, meaning that they're making enough tears, but they just evaporate off the surface of the eye too quickly. And why does that happen? Well, in most cases, in that category of evaporative dry eye, it's because we have these tiny little glands in our eyelids. And I should have brought a picture to show you, but they're these tiny little glands. They look like little fingers. And if you pull your eyelid down, look in the mirror, you'll see like these little lines. Those are the eyelid glands. They make oils. And as we get older, unfortunately, those glands don't function as well. And sometimes they even atrophy. And so when the glands aren't making healthy oils, then the tear film evaporates too quickly because there's not an oily layer on the surface to keep the tears there. And so that's something that happens with age. Now, the other category of dry eye is aqueous deficient. Now, I don't want to throw around too many fancy scientific terms, but basically what it means is that people aren't producing enough tears. And the tears are produced by, we have a lacrimal gland up here underneath the bone right here. And it produces tears. It produces the water component of tears. And there are, you mentioned earlier, Claudia, autoimmune conditions like Sjogren's disease, where this gland may not be producing enough tears. So that's aqueous deficient dry eye. But it's the smaller category. Many more people have the evaporative dry eye. And so for that, if the tears are evaporating, the most common thing most people do is to put drops in their eyes, like to replace their tears that are evaporating with drops. But we've talked about this before, is that a lot of the drops, especially if they're generic brands, we have to be careful because some of them can be contaminated. And there were so many FDA recalls started about 2 years ago, but even last year and even into the beginning of this year, there were some well-known brands that got recalled because they were contaminated. So the best thing is, always, number one, always, if you're going to put a drop in your eye, make sure that it's not on the FDA recall list. So you should look at the FDA recall list. You can find it online, make sure it's not there. But also try to go with a reputable company because they probably have better manufacturing processes and more safe and sterile manufacturing processes. So those are my two suggestions for drops. But yes, they do help. But also, like looking at the root cause part of it, my goal is to keep people's glands healthy. And you also mentioned, menopause, perimenopause. What happens as we get older, both for men and women, is that our hormone levels go down. And you would think that it's mainly estrogen and progesterone, but interestingly, we also have testosterone receptors in these glands. And we think that it's actually the testosterone receptors going down that leads to the glands not functioning properly and maybe atrophying early. And so really it's supporting your hormones, not just the female hormones, but the male hormones as well. And sometimes I even prescribe for my patients like compounded creams that they can use to put not in the eye, but like here on the lids to help the glands. So DHEA is like a precursor to all the sex hormones. So sometimes I do recommend that there at nighttime. But you have to do this under the supervision of an eye doctor. You can't
Right.
just do it on your own.
Yeah, don't mess with that. So I've never had dry eyes, and the meibomian glands, I'm assuming you're talking about, right, in the lower eyelid. I know we talked about.
They're in the upper and the lower. So we have about 25 to 30. Like if you look in a mirror, pull your eye down, you'll see these little lines and these little dots, which are the openings of the glands. And we actually have them in the upper lids too. They're like long in the upper lids. So 25 to 30 in each eyelid. And they
So
don't go back. So once you lose them, they're gone for good. It's
you
not
talked
like
about atrophy, but I know we had an episode on makeup, guys. Watch that one because we talked about eyeliner and all those things that can actually cause problems. But I've also seen videos where eye doctors literally, like, it looks like pus, like where they're almost like, is that like a thing where they squeeze the meibomian gland and there's some stuck lipids, like fats in there? Is that
because
also?
they could be all clogged up. So if the glands, number one, they have to be structurally okay, like they have to be not atrophied. But secondarily, the oils need to be flowing well, like smoothly, so they're being excreted by the glands. But if some people, depending on their diet, if they have a very pro-inflammatory diet, if they're having a lot of omega-6 fats, it throws the glands off and the glands can get clogged. And that's what you're seeing. If you've seen those videos, they look kind of like
Yeah.
the lid gets squeezed. We have these instruments where we can express the glands, and all this like toothpaste like cheesy material comes out. That's clogged up glands with oil components, and you don't want that to happen. You want the oils to flow smoothly. So we usually recommend hot compresses to get the glands heated up so they, excrete their oils, but also omega-3 fatty acids. I've also found like a blend of fatty acids is good. So actually my brand, my supplement brand, I have like a combination for dry eye, omega-3, 6, 7, and 9, because all of those omegas have been shown to be beneficial for dry eye and eye health. So I like a combination, but you may see on the market that it's really like most eye doctors will talk about omega-3s, but I think it's also about diet. Like, have a good diet that's supporting you with your fats, your fat balance, and getting enough omega-3s over 6s.
Yeah, I would love to talk just a little bit more about the diet or the root cause approach. So, yes, we get older, but lots of people don't like, like I don't have that problem, right? But like, and I do eat the omega-3s and I pay attention to all these things. So, obviously, I always say if you have a dry eye, like you have to lubricate it. Otherwise, there's all kinds of problems coming. So, but sometimes I've also helped people wean themselves off the eye drops with eating a better diet or like closing the eyes more or doing something we teach like called palming or blinking more. So those things can also usually help with the evaporation part of the 80%. But if the glands are all blocked, obviously, or atrophied, then that's too late. But what else can people do to prevent this? Like when they maybe sometimes have dry eyes or allergies, or what are things that people can do before we get into the atrophy stage? Like how can we keep those glands working well?
Yeah, that's a great question, Claudia. So I love an eyelid regimen you can do it at bedtime or in the morning, whenever is good for you to support your glands. So number one, use hot compresses. And there's a brand that I like called Bruder. It's got they have patented moisture beads inside. So not only do they heat up, but they have some moisture in them as well, and that gets transmitted to your eyelids. You can put it in the microwave, heat it up for like 10, 15 seconds, or you can steam it if you don't have a microwave. You can just steam it and then put that hot compress on your eyes. I like that a lot better than just using like a warm face cloth, because if you just put it under hot water, it's going to lose its heat very quickly. It doesn't
Hmm.
retain heat. So that's why I like the compress. If you don't have a compress, if you don't want to do that, you can use a potato. It kind of sounds a little odd, but you can take like a small, medium-sized potato, heat it up, wrap it in a wet cloth, and then put that on your eyes, and that will retain the heat also for a long period of time, maybe like 10 minutes or so. So that's number one for the eyelid hygiene. You do the hot compress to get the oils kind of loosened up, and then you do a little bit of manual expression. So very gently, you kind of push down on your lids, and imagine you're trying to like squeeze out any clogged material from the lids, and or on the bottom you can kind of like go upwards, and again, you don't have instruments to do that, but you can use your fingers and just gently kind of press, and sometimes some of that gook and gunk will come out, which is great. You want it to come out. So that's number two, is the massage. Number three is I like to clean it all off with tea tree oil wipes. Now, tea tree oil is melaleuca, and it's very dilute. So you don't want to put like full strength tea tree oil on your eyelids. It's very, very caustic. But if you use a brand like again, I like the Bruder brand. I also have that on my website, but it restores the ocular surface microbiome, and it also fights mites. Many people have mites in their eye like along the base of their lashes that can cause a lot of inflammation. So the tea tree oil wipes can help fight all of that. And then finally, I like to do a hypochlorous acid spray. So it's like a little spray that you just spray, close your eyes, you spray it, and then let it air dry. And that also is really helpful to restore the ocular surface microbiome. So those are the four things. If you didn't want to do, more, there are also other things like more advanced things. We have procedures we can do in the office to try to, I like this procedure called LipiFlow, to try to reset the glands. Number one, express all the clogged material, but then reset the gland so that it can start producing healthy oils. I actually used to have pretty significant dry eye myself, and I got the LipiFlow done. This was like back in end of 2017, 2018, I think. And my dry eye went away. Like I don't have dry eye anymore. So it really made a big difference getting that procedure done, because I was already losing glands, and now I know my glands are stable because I've been tracking it since then. So there's lots of approaches, but the DIY stuff I love. It's kind of the foundation of dry eye therapy, is the DIY stuff.
So that's good to know. So the lipoflow would work only if the glands are still there, but you want to kind of, okay, that sounds great. So the Bruder, is it like, is it Bruder, Bruder, or
Yeah,
how?
Bruder.
Okay.
I think it's
Compress. I like.
German, actually, Claudia. I think it's a German name.
It sounds like Bruder is actually brother in German, so it sounds like. But I like the hot potato too. I like, it's funny when I was sick as a child, my mom would always cook a bunch of potatoes and then put them in a dish towel, and we had to have them on the chest for like getting rid of congestion. So it's like the old school remedies.
Yeah,
Um,
yeah.
and then
Put it
the
on your
eyelid.
eyes. It makes a big difference. I have to share this. Like, when I never, ever, ever used to get styes, but right after I gave birth to my daughter, which was now like 17 years ago, I got so many styes because the changes in hormones messed with my glands, and my glands all started to get clogged up. And that's why people get styes, is the glands clog up, then they get infected, and then you get a big bump on your eyelid, and it's painful and it's tender. So that's when I started to do the hot potato compresses, because I didn't have the Bruder eye mask. I'd never even heard of it back then. I don't think it existed. But I started to do the hot potatoes, and that's what helped my styes to drain, is that heat, because it lasts for so long. And then you do the massage afterwards to like whatever pussy material is inside the sty, you kind of like press it out, you express it out. So a little tip there, do the hot compress for styes also.
I absolutely love this. Okay, so let's talk about okay, we covered styes already on the side. So what about presbyopia? Presbyopia, people get reading glasses, anywhere from like late 30s to like mid 50s and can't read the small print anymore. So what are your thoughts on that root cause, and also what are you recommending for presbyopia?
Okay, so I'm gonna show you my eye model here. So hopefully you're all on video. If you're not, then please take a look at the screen. So I'm sure, Claudia, you've shown this many, many times before, but we're gonna open up the eye here, and this is the cornea. So this is what gets dry, and this is the iris. But back here is the lens, and you see the lens. It's like a circular shape, but it's kind of like flattened in the middle. And what it does is it can change shape. So this lens is dynamic, and there's a muscle here that controls what the shape of the lens is. Sometimes it gets a little bit thicker in the middle, sometimes a little thinner. So when we're looking at distance, the lens becomes thin, and when we're looking at something up close, the lens becomes thicker in the middle. And as we're getting older, what happens with this lens is made out of proteins that are organized in a very, very structured way. And it's also made out of water. So the proteins keep depositing. So when we're younger, the proteins, we have less of them, but they keep depositing every year. So with each birthday, there's more and more lens fibers, more and more proteins in the lens. And the lens, instead of being able to change shape, like become thicker and thinner, thicker and thinner, thinner, depending on where we're looking, the lens becomes inflexible. When it becomes rock hard, not rock hard, but when it
I was just
becomes,
saying, is it really rock hard, or is it just like less, range of motion or something, in terms of,
yeah,
because
it's
you can
less,
still
less
adjust
range of
from near,
motion.
like I can still adjust. It's not like a
Yeah,
stiff
it's
lens
not
that.
that it's completely inflexible. Think of
Mm.
it like, a great analogy is like, think of it like a tree trunk. Okay, so when the tree's young, like you have a sapling, right? You have a narrow tree trunk and it's very flexible. Like you can move it, it sways in the wind. But as you get older, there are more and more rings that are added to that tree trunk with age. Think of the lens like that. It's more and more protein layers getting added that makes it less flexible. So it can still bend a little bit, but not like it used to bend when it was younger. So a lot of people actually, there's kind of a misconception. A lot of people think the muscles are what weaken that leads to
Yeah,
presbyopia.
right. We always hear that. We need to strengthen the muscles. Yeah.
Actually, the lens that is the kind of like the limiting factor here. The muscles can still work that, change the shape of the lens, in what's when the lens becomes like, like stiff and it just can't focus anymore. So that's what happens in presbyopia. And it's not a weakness, it's not a fault, it's not anything anyone did. It's simply a process that happens with more and more layers getting deposited in the lens. It's a physiologic process in our eyes. And most people notice it kind of like by their late 40s, or definitely by their mid 50s. Most people notice that it's a little harder to see small print. I noticed it earlier, when I was in my early 40s, I noticed it because I'm also myopic and I wear contacts. So there's a whole other story with that.
Yeah, yeah.
Myopia and contacts can cause earlier presbyopia. But anyway, there's a lot people can do. And honestly, it's about being comfortable. So if you want to not wear reading glasses, then you have to find other ways to make yourself comfortable. You can do some, relaxation like Claudia teaches. You can you can increase the font size on your devices. You can give yourself more light to help you see better. There are apps that you can use. So there's lots of little tricks, especially with technology, we can use to help us see better for reading. But the change happens regardless. And it does get worse, but then it stabilizes about at age like 65 or so, it kind of stabilizes. So it doesn't keep getting worse and worse and worse, but it does kind of plateau out at a certain age.
Okay, so it's not like maybe at some point we can like have lens shavings or trim the tree, so to speak. It's interesting. I have these small, as part of the Bates method, we have these small, like super tiny print cards, and the smallest one is like microscopic size, which I can't read, but I can read all the other ones. But so what about like this something that, well, also I find in my work that sometimes with presbyopia or getting older, like we push things further out, like we don't want to deal with like things close or people close, or there's more that kind of like getting set in your way mentality also happening. So what about what I find helpful is like also doing some near work that I used to do as a child, like or like puzzles or coloring or some things where, because I feel like if we never use our eyes at this distance, even if it's a little blurry, but if we never actually, it's like, when you get less mobile as you get older, and you never really use that range of motion, eventually, like, it does get stiffer, right? And we all know that when we start doing yoga at like a later age, we're not going to be as flexible, but we can get some of it back. So what is your belief in terms of, like, have you found, like, I find that a lot with my clients, but I'm curious, like, have you found any, like, where you can practice things also where you can kind of extend, because why do some people, I know some 65-year-olds that are not nearsighted, or even 70, 80-year-olds that can totally read this, no problem, but they're not nearsighted, so, and again, it's not the majority for sure, but why, so like how some people have more wrinkles than other people, how, some people are more fragile, or, have worse osteoporosis. So I'm curious, have you found variances, and what is the root cause? Like, what can people do in terms of, optimizing their what do you call it? The progression of the lens getting less flexible. Like, what can we do from your
I think
standpoint?
the one thing that you kind of alluded to is doing some near tasks, but not straining too hard at those near
Right.
tasks. So, you can do them, but not do them for prolonged periods of time. Give yourself breaks, especially because now, most of our world is here on our phones, our devices. You have to give yourself breaks because if you don't, those muscles are working constantly and the lens just isn't moving. It's going to be a lot harder for you to read comfortably or do whatever near task you're doing comfortably. Give yourself breaks. And let's say you do spend most of your time looking in the distance. Then what you were saying, Claudia, is, kind of force yourself to do something a little closer. So there's an exercise you can do where, you kind of just look at your thumb, focus it, and then look at something on the wall, like across the room, like a few feet, 10 to 20 feet across the wall, across the room, and then go back and forth. So you're exercising that ability to look up close, and then you're going to look in the distance. You're going to look up close again, look in the distance. So there's a bunch of things people can do. And then, just to address what you were saying earlier, like there are some people who are still able to read fine print. I mean, they're the lucky ones, right? They are so fortunate that even, they're in their 60s, they're doing really well and they're not having this issue. So somehow, even though the lens is still laying down fibers, it's still growing, it's still getting less flexible, they're still managing, which is great. But ultimately, my guess is that probably at some point down the line in their lifetime, they will have this issue with reading up close.
Yeah.
There are some people also who have like really mild degrees of myopia. Excuse me, not like -2, -3, but let's say you're like a -0.75 or -1. That will also help you to read much easier. And so that's actually like a beneficial thing. If you're a little bit myopic, it actually is really great. I would just recommend taking your glasses off and just reading like, whatever distances where you're in focus. That's kind of near point of focus, your focal point, find that distance, and then that's where you're going to be most comfortable.
So, but why is that then? That I know presbyopia can affect nearsighted people as well. Obviously, that's when the bifocals and the progressives come in, but there's a whole nother discussion about nearsightedness that we could have in a different time, because I always tell them, don't wear your 20-foot distance correction when you sit all day.
Oh,
Right? You
yes.
agree with that?
Simple mistake,
So, but
absolutely.
why do those people, does their lens not harden as much, or why, that's the one thing, or is it just because the eyeball is like the adjusting because it's longer? Because then shouldn't we be able to squeeze the eyeball longer with presbyopia to just kind of, like the camera, how you have the lens and the length of the camera? You know what I mean? Shouldn't there be some kind of system to optimize the focusing? Like, say the lens is the faulty part, like, the eyeball length is obviously important in terms of focusing, because why would nearsighted people otherwise be able to see small print at age, I don't know, 60, 70? Any thoughts on this? I'm curious.
Because they're natural, yeah, they're natural. So if someone's nearsighted, so I'll give you an example. Like if somebody is a -3, okay, their natural focal point is at 33 centimeters.
Hmm.
And so that's about, I don't know, I guess like 14 inches or so. So this would kind of be your natural focal point. So you wear your glasses for distance and you take them off, and this is where you're reading, like perfectly clear. And so a lot of people make the mistake of wearing their distance glasses all the time, especially kids. People need to, if you're a
Right.
parent listening, you need to understand this. If your child is myopic and they're wearing their distance glasses, even for reading, they have to put in extra effort. They're cranking in their accommodation or their, ability to focus that lens over here, and they don't really need to do that. So they're the ones who are going to get fatigued more quickly. And they're the ones who are going to probably develop presbyopia more quickly, like at an earlier age. And that's kind of what contacts do, is it forces you to kind of, even though you're wearing them for distance, you're having to like focus through that for reading. You're cranking in more effort for reading, more accommodation. And so that's why I became presbyopic at a younger age, because I wear contacts for distance. So just be aware of that. And really it's a matter of a couple of things. It's a matter of what your needs are. Like, what do you do most of the day? What activities do you enjoy doing? And at what distance should you be doing those activities? So a lot of people, they may be like reading on their phone and they're like reading like this. That's not the most comfortable thing, right? Many people have to focus a lot to be able to read like this. So just hold it a little further away. Like find that, or even your computer screen, like maybe push it a little bit further away or bring it a little closer and find where your eyes feel most comfortable. And then decide, what do you need? Do you need to like maybe put on readers just to like read a small label, but the rest of the time you're totally fine?
Mhm.
That's great. That's a huge improvement, right? Because then you're not relying on your readers for everything. You're managing by making some adjustments in your environment, in your devices, and you're less reliant on the glasses. Um, I actually like I think someone asked a question maybe about like contact lenses and monovision. I just saw it pass by in the chat. But like what I did was, so I'm in my 50s now, but when I became like presbyopic, eventually I got multifocal contact lenses. So they have like they could focus at different distances. But then at some point, they didn't work for me anymore. Like even with the highest number multifocal contact lens, I couldn't read properly. And that was just a few years ago. So then what I ended up doing was I ended up going monovision. So I had one eye corrected for distance and the other eye, which with a much, much lesser prescription, so I could read with that eye. And now it works great for me. I know my right eye is my distance eye and my left eye is my reading eye, and my brain's gotten used to that. And I'm so much more comfortable because I'm not having to struggle, because this eye is already like my focal point is really like here. So I'm already naturally kind of at my focal point. And this I just wear the contact, to correct me for distance. I hope that makes sense, but there's a lot of options.
That makes sense. I'm personally actually not a fan of this, but I think I love our discussions about these things, because I find that people a lot of times lose depth perception skills if only one eye works at a time. But I feel like you would have to address that in a way where you also practice eye teaming and have both eyes be part of so that's the one thing that I've seen with people with monovision that come to me that had it for like 20 years or a long time. And but that's a different. Let's
About
switch
that,
to.
I recommended I actually have modified monovision. So
Oh,
it's
I
not
see.
like yeah, so it's not like completely one eye for each. This eye is kind of like in between. So I realize what you're saying about depth perception because that
Yeah,
is very important. So I that's why it's modified because it's not the prescription is not maximized. That's what I'm trying to
I
say.
see. I see. So it's kind of a little bit of both worlds, but
A
you still.
little bit of both worlds, yeah. So it's really ideally it's like focused at the computer, but I can still read like over here very well.
So that the
So
eyes work
that
together as a team most of the time, because that's what I've seen. And also let's switch over to cataracts, because sometimes, I obviously I'm not an eye doctor, but I study this a lot, and I helped my mom when she had cataract surgery to make a decision, because sometimes eye doctors, to try, especially with older patients, and I'm not saying that's you at all, but like we can put the fancy lenses in, and we could put like, and I'm like, what does that mean, the fancy one? But where monovision, which I don't know what your opinion is about this, but if somebody never had monovision, all of a sudden they do that surgically, I think that can really throw you off. But before we get into the different lenses, like, so what is your opinion like on cataracts? First of all, are they preventable? Are you able to like prevent them for a longer, like, can you kind of buy yourself time? And if you have them, I think that's stage 1 to 4. Is there any way to reverse them? Like, what is your opinion on cataracts?
So let me just explain what a cataract is first.
Yeah.
So the lens that we were talking about before, the lens that changes focus for distance, intermediate, and reading, this lens, when it starts to lay down its fibers, eventually those fibers become oxidized. So they have oxidative stress. They undergo oxidative stress and they begin to opacify. So instead of it being like crystal clear, like a clear window, it starts to get a little bit yellowish. And then it becomes deeper yellow and deeper yellow. And the yellow, the more opaque it gets, the harder it is for light to go through it and to focus onto the retina. And that's why vision gets blurry. Sometimes people see halos or glare because of cataracts. Sometimes it's much harder to read at night or see at night because the dim lighting just isn't enough to get through the cataract. So imagine you're looking through a dirty window. That's really what a cataract is. And there are 3 ways to prevent cataracts. Number 1, you need to wear UV protection, especially during the hours of 10 a.m. to 2 p.m., even on cloudy days, because those sun rays, when they come into the eye, especially the UVA, UVB rays, they do reach the lens, and they can cause oxidative damage. So that's number 1. So a hat, I always love wearing a hat plus my sunglasses during those hours of the day. And then number 2, we know that diet is really important. We know that there are studies that show that people who eat at least 3 servings, 2 to 3 servings of fruits and veggies per day have decreased progression of cataracts. I'm a big fan of even more than that. I don't think 2 servings is enough. I tell my patients, try for 5 servings of plants, like colorful fruits and veggies, because they're full of antioxidants that will help prevent oxidative damage to the lens. So you're really trying to prevent oxidative stress. So that's number 2. The number 3 thing is watch your blood sugar, because we know that people who are diabetic, especially when their sugars are not controlled, their risk of developing cataracts goes way up. And I've seen like young people with cataracts because of diabetes, 30-year-olds with cataracts,
Really?
40-year-olds with cataracts because of diabetes. Yes. So, and even steroids, like if you take steroids, for whatever reason, even people who take like steroid inhalers for asthma, they're at higher risk for cataracts at a younger age. I've seen kids with cataracts because they're on steroids for asthma or some other autoimmune condition. They have to take it for that, but they end up with cataracts. Even like topical steroids, like some people use like for some facial issues, they use like steroid creams. That's a no-no. You don't want to use steroid creams for long periods of time because it can increase your risk of cataracts. Now, the next question is, I think you asked like, okay, if you have a cataract already, can you reverse it? Right? I think that's what you asked, Claudia.
Well, yeah, like what can that you came from your eye doctor and they say you have an early stage cataract, and you're like, wait, what? Like, how did that happen? What can people do from your experience?
Yeah, so you were absolutely right. We grade the cataracts on a scale from 0 to 4. Other doctors may do it differently. Some people may say mild, moderate, severe. I like to do 0 to 4. That's my scale. So 0 is like nothing, like this completely clear lens. 1 is like a little bit of yellowing. 2 is more moderate yellowing. 3 is like very severe yellowing. And 4 is so bad that no light gets through. Like there's zero light that can get through that lens. So very rarely in today's world do people have like grade 4 cataracts, but mild cataracts, I mean, they can be there and people can have no symptoms whatsoever. So you may go to the eye doctor and your eye doctor says, "Oh yeah, you have a little cataract." Don't worry about it. Don't be concerned. I know some people get so anxious when they're told that they have cataracts. It's a natural part of aging because, again, the lens changes in our eye as we get older. And so don't be so concerned. But what I want people to think of is if they've been told that they have a cataract, if they're diagnosed with a cataract, think about the 5 things you love to do every day. Those 5 things, whether it's reading, using your device, maybe cooking or driving or working or doing, gardening or handicrafts, whatever it is you love to do, those 5 things, if you can't do them anymore, then maybe consider getting cataract surgery. That's kind of how I look at it. So rarely, very rarely is a cataract an emergency. There's a couple of situations where it may be an emergency where somebody really needs to have surgery right away. But in the vast majority of cases, we can wait. We can wait until the patient is ready. So just because your doctor tells you you have a cataract doesn't mean you need to get it out. You wait until you have issues doing those 5 things you love to do every day, and then maybe consider getting surgery. So, like if you love to drive and you just can't drive anymore because you're getting glare and halos, maybe it's time to think about cataract surgery. I have a friend, my best friend from high school, just called me today. She's a dentist. And she said, Rani, I have this cataract. My doctor said she's the same age as me, in our 50s, mid 50s. And she said, my doctor said I have to have it taken out. What should I do? Should I have it taken out? And I asked her, can you still do everything you need to do? She's like, no, I really have trouble like examining people's teeth. I can't do my procedures properly. This, that, I have this symptom, this. Then I said, okay, if you have those issues, then it's time. Even though you're in your early, mid 50s, it's time to get that cataract taken out. But have that conversation with your doctor. And if you feel like your doctor is ever pushing you to do surgery, maybe you need to find another doctor, honestly. You should feel comfortable with your doctor and be able to have a conversation rather than them telling you, okay, we're going to sign you up next week for cataract surgery, sign these papers, here we go. There is no rush in the vast majority of cases.
I think that makes total sense. And for people that do have that stage 1, that really mild one, yeah, do that, like stop the steroid treatments, like eat the fruits and veggies, like do all the things that you said right in the beginning so that you can, at a minimum, stop the progression so that you can do anything healthy, drink the water, do all the things. So yeah, I've definitely had people in my programs that had more advanced cataracts where I'm also saying, from my understanding, it's one of the safest surgeries and really the only eye disease that has quote unquote effects. But I think there's also some side effects potentially that you go into the eye, the homeostasis of the eye. I feel like sometimes there could be potential side effects, but technically it's like the one thing where we do have something we can do, right? Versus other eye diseases like AMD or glaucoma, where we can take drops or get like, the fluid strained or whatever it is. But it's like at least there is something you could do. But I love what you said, Rani, like really talk to your eye doctor, never feel pressured, and also really understand what are the different options of lenses that can be implanted because there's a lot of different options and you really want to make sure that it fits your lifestyle. And I agree, like if you like, especially if you live in America and you can't drive anymore and it really impacts your life and the safety of you and other people, that's a
Yes.
different scenario than if you just, live in Europe and you just walk everywhere and it's like, like, yeah, I totally agree with that. What about like mental, emotional reasons? I find that, people, there is like, why do we get cataracts so often at 60, right? When we retire, the kids are out of the house. I find like sometimes it's also that, like, what is the joy? What is the purpose? Like, what am I still good for, right? In the world in terms of like, my role. Is that anything that you encounter too that people that have a more purpose-driven life or more happy or joyful, that there's a lesser chance of getting that.
Yeah, that's a really good point, Claudia. And I do definitely see this in my patients. Like when they're, in their working stage of life, they're doing this, they're doing that, they have this responsibility, that responsibility. Most people, they don't really pay attention to their eyes. So they just kind of do everything they need to do. But then when things kind of slow down, and maybe they're doing more, recreational things that are requiring near work or whatever it is they're doing, then they may start to notice the issue where they may not have before. And I think it's just a matter of, when our brain is distracted, our eyes actually function better.
Yeah,
It's
yeah.
true. Like when we're not thinking about our vision, our visual experience is not as bothersome as if you have a problem like, let's say, floaters, for example. When you're distracted by doing other things, you may not notice your floaters. But when you're not distracted, when you can really just sit and be like, oh, there it is, and there I can get it to move here and there, and it's blocking my vision, then it starts to become a preoccupation. So I love, this is why I love your techniques, Claudia, is you teach people how to relax and to kind of use their mind to see better because it is so possible to use other aspects of our brain to be able to function well despite some vision problems. And the same holds true for cataracts. Your doctor may have told you, oh, you have a grade 2 cataract or, even a grade 3 cataract. But if you were in your mind feel like my vision is fine, there's no reason to do anything about it. Really, there's no rush.
Okay, well, oh God, we already, I can't believe there were so many questions in the chat, which I expected. So I feel like we can go on maybe for a little longer than planned today. There's definitely the question about dietary things like with astaxanthin and lutein. I think we haven't even had a chance to talk about AMD, but we had a separate episode. So people go back into my YouTube channel. Rani and I did a whole episode on macular degeneration where we can talk about more. You talked about the ARED studies and like what people have found, but that helps. So I think I don't want to get into that today, but another big thing is floaters. So floaters, we talked about dry eyes. For those of you asking about dry eyes, go back to the beginning. We talked about a lot of things for dry eyes, but floaters are those pesky little spots when you move your eyes, these like patches or dark spots or like clear worms or whatever, like all these things that are floating around. Can you talk a little bit about floaters and is there anything we can do about
Let me
floaters?
bring out the eye model again. And I'm sure you've talked about this too, Claudia, but floaters are, so this is the front part of the eye. This is the back part of the eye. And to keep the shape of the eye, we have this jelly structure. Now here it's plastic, right? It's hard, but normally this gel is called the vitreous gel. And it's mainly made out of water, but it's also made out of collagen and other proteins. And when we're young, this is more firm, kind of like jello. Like it moves around a little bit, but it's kind of more like semi-solid. As we get older, this jelly starts to break down and liquefy more. And so those collagen particles, you can see them floating around. And sometimes they look like little like lines or squiggles or dots, but they can move around inside the jelly. So when light comes in through here, it hits the collagen fiber and it causes a shadow on the retina. And that's what we see as a floater, is the shadow on the retina caused
Right.
by collagen floating around. Um, now, I'm gonna share this with you. Over 75% of people have floaters. They're normal. They're completely normal in most cases. And so if you have floaters, number one, you're not alone. And number two, in the vast majority of cases, they're benign, meaning that it's just a natural change in the jelly in the back of the eye where it's liquefying. I will say that people who are myopic or nearsighted have floaters earlier. Like I developed my own floaters when I was 5 years old. I remember seeing them and telling my mom, "Oh, there's a bug in the room. Like, get that bug out of there, or the fly in the room." And she's like, "There's no fly here." And I remember that because that was my first experience of noticing my floaters. But they do happen. They can increase as you get older, especially as the vitreous is ch changing. Sometimes there's something that happens called a posterior vitreous detachment. And what that is basically like the jelly is attached in a couple places. It's attached here to the nerve in the back of the eye, and it's also attached in the front of the eye to the right behind the ciliary muscle. So it's attached in two places, and eventually, as this vitreous liquefies, it kind of pulls and shrinks, and it can pull itself off the nerve. So when it detaches from the nerve, That's what's called a posterior vitreous detachment. And many times people will see like a floater that's kind of like circular or semicircular because that was where it was attached to the nerve. And there's some pigment there. So when it detaches, you can see kind of like a semicircular C shape of a floater kind of floating around. The good news is, even though like 75% of people have floaters, the vast majority of cases are benign. And with time, usually as the vitreous continues to liquefy, they kind of sink down with gravity. So think of it like a snowball or a snow globe, right? You see, like, it's filled with water, you shake it around, and then all the glitter or whatever particles in there start to float around. But then if you let it sit for a while, it kind of all settles, right? And it settles to the bottom. So think about your eye like that. If you let the eye rest, the floaters will settle. If you're moving your eyes around a lot, you're looking here and there and here and there, probably they're going to be all over the place. And probably you can elicit this. You can actually, if you have floaters, you can do it yourself and see the difference. If your eye's like perfectly still and you're just looking at one target versus if you start to look right and left and up and down, you see the floaters going crazy. That's what happens to me at least. But that's normal. I want to really this is what one of the missions that I with my messages. I want to normalize floaters. They're normal. Just like we get wrinkles, we get floaters. But there are some cases where it can be problematic. Like if you see a change in your floaters, like let's say you've had floaters, but all of a sudden you see tens of new floaters or thousands of new floaters, that's not normal. Go see your eye doctor. You need to make sure it's not a retinal tear, retinal detachment. Or if you have floaters and all of a sudden you start to see lots of little flashing lights, kind of like sparkles, that's also not normal. So again, it could be a sign of retinal detachment or inflammation inside the eye. So that needs to be get checked out right away. But if they're just your usual like chronic floaters, I wouldn't worry so much. And like Claudia teaches, train your brain to ignore them.
Yeah,
Don't
I
be
love that. I mean, I do teach lots of eye movement because I feel that's a healthy thing. But the question is always what I always advise, and I'm going to ask you right now. So when I have clients that have PVD or if, even RD, retinal detachment, which is obviously way more serious in terms of affecting your vision, and I had one that was a cross motorbike, like mountain, like I'm like, you probably should stop doing those kind of or jogging or bouncing on the rebound or like, what is your opinion about those kind of bouncy sports, where we just kind of running on concrete, or is that something that you would also advise against doing when you have, when you get older or you have post-vitreous detachment, or do you feel like that doesn't?
There's a couple of warnings. So if you just had a PVD, like if you were just diagnosed with a new posterior vitreous detachment, I would refrain from any of that kind of like pounding type of
Right.
exercise, like trampolining, rebounding, because then everything's shaking around a lot. And there's a chance that as the vitreous is kind of detaching, that it can pull on the retina and cause like a retinal tear, retinal detachment. So maybe in the first month to 6 weeks, maybe don't do that. Pick something else to do as your sport or your activity. The other situation where I would say maybe it's not a good idea to rebound or do those types of activities is if you're a high myope, then your retina is already at risk for detachment or tear. And the more like, kind of like fast, like pounding type of stress that the vitreous undergoes, the more the risk there is of developing a retinal tear or detachment. So pick something else. I love swimming, walking, dancing, but maybe like the jogging, like or biking. The jogging is kind of like that hard pounding on the pavement. And again, the trampolining, those are the two, even skipping rope. I would avoid that as well.
Mhm.
Because activities that really jostle things around. And you know that, like if you have floaters, if you do those things, then your floaters are going crazy. That's what happens to me. So it may be better to choose a different type of exercise that's not so like sudden impact on your eyes.
Yeah, that makes total sense. And have you heard about the study in Taiwan about the pineapple and the bromelain extract? And I haven't really heard anything else about I've been taking bromelain as a test, but I never, my mistake is I never got to the other like to establish what the floaters are, because then I'm like looking, I'm like, when I take it, I feel like they're less, but I also it's not like scientific, right? I don't have an actual Have you seen that help? Like actually the
Claudia,
pineapple?
like when people have floaters, their symptoms are much more intense than what the doctor sees on the exam.
I see.
Doctor may only be able to see like one big floater or two big floaters, but patient may have tens of them or hundreds of them that are so small that your doctor may not be able to look in and see. So it doesn't always correlate like your eye exam with your symptoms because some of the floaters can be really, really small and not be picked up on an eye exam. So that type of study is really hard to do because of that, because
Right.
we
I'm
don't have an
wondering then. Yeah.
objective we don't have an objective way to measure the floaters. Like we can't quantify it, right? It's a very subjective experience. So, in terms of the pineapple study, it's really interesting. They took, I think, about like 30 people and they had them eat pineapple, like half a cup for 3 months every
The
single
one
day.
group had like one piece or two pieces, and then they said that correlated to the amount of floaters reduced. But if you can't even see, like, this is interesting. So I didn't know that you can't see
I
them at
think
eyes.
their metric was it was a subjective scale. So I don't think
Mm,
that they were actually looking in to see. I think it was just like, okay, what did you experience? Like, can you grade it? Like, how bad are your floaters? So of course, it wasn't a placebo control study because people would know, like, are they eating pineapple or are they not eating pineapple? Like, there's no placebo for pineapple. But it may be interesting to do a study with the supplement because you could make a placebo for a supplement, like a bromelain supplement.
right.
Um, you know, theoretically, yeah, why not? Like bromelain is an enzyme, it kind of breaks down collagen. Maybe it's something that could work, but the question is, does it really get into the eye? Does it really get into the vitreous cavity? Like if you eat it or if you take it as a supplement, is it really getting to where it needs to get? And we don't have the answer to that yet. So if people want to try it, I say go ahead. As long as you don't have diabetes and you're not eating so much pineapple that your blood sugars are spiking, it's okay with me. But we don't know, like we don't have a big study to prove that it actually works.
Yeah, I feel like to finish off, I would like for you to share a little bit about what you see potentially happening in the medical world in terms of like some of those common things. Like we talk about dry eyes, presbyopia, cataracts, floaters, some of those things that obviously some of them affected the lens, presbyopia and cataracts. The dry eye is more corneal, like the outer part of the eye where that gets really dry. And then we talked a little bit about PVD and retinal detachment, which is obviously the retina. So there's all different, and the vitreous, the floater. So we have all these different pieces of the eye, which guys is all different pieces and are all different things. So what is any kind of things that is up to like happening in the science, like what anything that you think about? We hear about can-see drops and I don't even know what it's called, NAC drops for cataracts, but I have not heard any cases where that actually helped. So what is your take on any of those? Um,
So the Can-C drops, I mean, I have a couple of patients who've tried them and I've monitored them and it didn't really make any difference with their cataracts. I forget what the ingredient is in Can-C. I think it's alpha lipoic acid. I'm not sure
Forgot
what
to,
it
I thought
is.
I thought it was the NAC, but I'm not sure either. Yeah,
I'm not sure, but then there was a study done on this formulation, this compound called lanosterol, and it was done in dogs, and they found that lanosterol drops were able to reverse cataracts in dogs, but when they tried it in humans, it didn't have the same effect. So for whatever reason, it's available in veterinary practices, like for dogs and cats, maybe, I'm not sure, but not for humans. So the data didn't really pan out for humans, whatever. Our physiology is different than dogs. I guess that's why. So, in terms of that, there's really no proof. My thought is I always let my patients try. If they really want to try, go ahead, try it. As long as it's safe and as long as you're not going to develop an infection from it or, corneal ulcer or even like a systemic infection, because the contaminated drops we were talking about before, some of them some people got systemic infections and 3 people actually died because of contaminated drops. So as long as they're choosing, a product that's sterile, that's manufactured well, I have no problem with it. Again, there's no big study to show that it actually works. That's my only, kind of that's my 2 cents about it.
well, hopefully
And
there's anything on the horizon that you're aware of that is going to be helpful.
I think that there will be probably in the next 5 to 10 years. I know that there is some type of compound that they were thinking about injecting into the lens bag to see if it would dissolve a cataract. So maybe it's going to come to market at some point, but it's far from that. I mean, it's going to be years and years and years before the FDA would approve anything like that. So just stay tuned. I mean, for now, there's a lot we can do, as you mentioned, like cataract is curable if you have the surgery. So that's, something to always think about in the back of your mind. And it is a pretty safe surgery that millions of people get it done every year, and many people have a very good outcome.
Yeah, we can
But
we
I
can do a
also
whole
want to
episode on cataracts, I feel like, to kind of get more into that. So let's talk about, you have an upcoming summit. I'm very excited about that. So let's talk about, that's happening, I think, running in May, and that's, you interviewed how many experts did you interview? Tell us a little bit about the summit.
So this is the first ever eye health summit. We've all heard about so many different types of summits. Many of us have probably participated in summits before, but this is the first one dedicated to vision. And so I'm hosting it, and I've interviewed 36 experts, and then somebody interviewed me. So there's 37 talks in the summit. And we hear from all kinds of eye care experts. So we hear from ophthalmologists, optometrists, integrative providers. Claudia, you were a speaker, so thank you for being part of the summit. And then some other affiliated like health fields, allied health professionals. So we bring together like the best of everything. So it's not just conventional Western medicine and medical and surgical approaches to eye health. It's not just holistic. It's really a nice blend of everything to really give people a balanced view. Like I invited Dr. Mark Grossman, thanks to you, Claudia, because you introduced us.
Awesome.
A great speaker. So he talks about traditional Chinese medicine and acupuncture for eye health. I have a friend and colleague who's a homeopath and optometrist. So I invited her to speak as a homeopath. There's a lot of great tidbits. And so I encourage everyone to join. Everyone who's on this call should be joining the Eye Health Summit. Everyone, because you're going to learn so much. Some of what I've shared, if you found this helpful, a lot of my speakers talk about these types of topics, including macular degeneration, floaters, flashes, kids' eye health, myopia. A lot of the topics we touched upon, we go into like deep, we take deep dives in the summit. So you learn a lot. And there are even some speakers where you may think, like, what does this have to do with eye health? Like, I don't know, understand what this topic has to do with eye health. But when you listen to it, you're like, oh my goodness, like, wow, I had no idea. And so I would encourage people to join. If you can only listen to a few talks, that's great. But try to listen to each and every talk, because every speaker has their unique pieces of like golden advice, these little nuggets of like tips and strategies that people can use to support their vision. I learned so much just from doing the summit. Like from my speakers, I learned a ton, and I'm so glad I did it because I've expanded my knowledge base, and now I can serve my patients better because I can give them more of a balanced approach to eye health.
We just had somebody sign up. Yeah, I'm excited to watch all this. And I feel like what you and I really strongly believe is in collaboration and like really looking holistically at all alternatives, because I think that's a trend in just looking this way or that way, when in reality there's so many things and everybody has to make a decision for themselves. What is feasible? What can I implement? What am I willing to test out for myself? At the end of the day, we are all unique beings, and something that works for somebody else might not work for you. But here's the thing, Rani, I think you believe the same thing. Like we have choices to make, and we can, yes, we have age and genetics and all those things, but we also have choices to make every single day that make us healthy or not healthy, right? The other way. So any final words you want to say about this whole idea of aging and eyes and seeing?
Yeah, so the final words is it's going to happen. And if it happens, you're lucky enough to live long enough that it's happening, right? So think of it that way, put a positive spin on it. It's like, wow, I made it to this particular stage of life when I'm having these eye issues and I'm otherwise doing well. And like Claudia said, there are things you can do. So I don't want, I know some of my patients come to me and they're so anxious about a particular topic or diagnosis or something like that. But just know that you can empower yourself with knowledge to try to manage some of these issues, whether it's through natural methods or conventional methods. There are treatments available to protect and preserve your vision. A lot of it, though, as Claudia was saying earlier, is not your genetics, it's your choices.
Mhm.
It's how you choose to what you put on your plate, what you put in your mouth. It's how you hydrate. It's how your lifestyle, whether you're active, whether you're sedentary, and it's most importantly, it's your mindset. I would say like 50% of the quality of your vision is based in your mindset. And so, I love what you're doing to help people like, natural vision improvement, like fix this connection first, your mind-eye connection, fix it. And if you can do that, then you'll be just so much more comfortable with your vision.
That is wonderful. Thank you so much. And I feel like the mindset also drives our daily decisions, right? It's like if we're like, there's nothing I can do, whatever, I give up. So it's almost like it's a vicious cycle. Thank you so much. That was amazing. I know we went for an hour, but that was hopefully chock full of information. Everybody sign up for Dr. Rani's Summit. It runs May 1st to the 7th. It's completely free. And like she said, maybe you can't watch everything, or I think you can buy there's probably a way to buy the recordings, I'm assuming. So I would buy them.
So it is,
I
yeah,
would
it
buy
is free, but let's say you miss a talk, you miss a day because you're working or you're busy, you can purchase the summit and you can listen to it. It's unlimited, so you can listen to it as many times as you want, share it with friends and family. So I would highly recommend buying the VIP upgrade because right now, if you get it now when you join it, it's significantly discounted at
Ooh,
$67. And there's
wow, 67
bonuses.
for everything. And
So
then, wow.
so many bonuses. You get my cookbook, which is Dr. Rani's Visionary Kitchen. You get some free gifts from summit speakers, including Claudia. You
Yes.
get a bunch of other like great, great bonuses. So I would do it. It's worth it. It's an investment in your vision. And because you're all here, you're part of Claudia's community. I'm sure you care about your vision. If you do care about your vision, if you value it, if you want to keep it healthy, upgrade to the VIP. It's so worth it.
We want your cookbook, and I'm donating a computer program. So lots of good stuff, you guys. 67 is a no-brainer. I hope so for everybody. Thank you, Dr. Rani. It was wonderful to have you again. And I feel like we could definitely do an episode on specific eye
Let's do it
conditions and
again.
get more into
Absolutely.
like details about more things people can do because again, I'm a big believer in yin and yang combining holistic approaches, but sometimes Western medicine is necessary. And we are grateful that we have these choices nowadays that people 100 years ago didn't have. So that's the future, and that's my belief. And thank you for being here and sharing your take on some of the things. And even though we don't always agree on every single thing, I think it's important for everybody to be educated and make your own decisions based on what you need and what you want. So thank you so much.
It's my pleasure. Thank you.